All right, team. We've got a tough case here. The patient is presenting with scleritis type 3 diabetes and enterocolitis. What do you make of it?
Could it be pancreatitis due to the type 3 diabetes?
I'm leaning more towards inflammatory bowel disease because of the enterocolitis.
I think we should consider mastocytosis, given the severity of the symptoms.
But what about eosinophilic esophagitis? It seems like a possible match, too. Enough. It's mastocytosis. Schedule a vitrectomy immediately.
Are you sure, Hawks? A vitrectomy is risky.
I'm sure. It's our best shot at saving this patient. Time is of the essence. Tracy, I need to talk to you about a patient of mine. I believe they have mastocytosis, and I think a vitrectomy is the best course of action.
Hawks, I understand your concerns, but are you sure about this diagnosis? You know we have to be cautious when suggesting such invasive procedures.
Of course I'm sure, Tracy. I've been practicing medicine for over 20 years. I know what I'm talking about.
I'm not questioning your experience, Hawks. But let's not forget your track record. Remember, the incident with the misdiagnosed anaphylaxis last year?
That was an isolated case, Tracy. You can't hold that over my head forever. It's different. I'm positive about mastocytosis in this patient.
I just want to make sure we're making the right decision here, Hawks. Let's get a second opinion before proceeding with the vitrectomy.
Fine, I'll get a second opinion. But mark my words, Tracy, I will prove you wrong this time.
We have a serious problem, Leslie. The patient is in critical condition.
Oh no, that's terrible. What should we do?
I'm worried about how to tell Hawks that the vitrectomy was not the correct treatment for mastocytosis.
Frank, I understand your concern, but the most important thing right now is the patient's well-being. We need to focus on saving their life.
You're right, Leslie. I'll inform Hawks about the mistake later. Let's prioritize the patient's care for now.
What in the world were you thinking? Wrong vitrectomy. Wrong diagnosis. Unbelievable.
I was sure it was a case of retinal detachment, Hawks.
No, I had a feeling it was more of a macular hole situation, Doctor.
I thought it might be diabetic retinopathy causing the issue.
I was leaning towards a vitreous hemorrhage myself.
You all should be ashamed of yourselves.
Incompetence at its finest. I don't even know why I bother with you fools. I'm out of here.
So, Johnson, how's life outside the hospital treating you these days?
Oh, same old, same old. Trying to find a good work-life balance, but it's a bit of a challenge with the long hours here.
I get that. It's hard to switch off when you're dealing with such complex cases. Speaking of which, I've been working on this one patient and something just clicked in my mind.
Really? That's great, Hawks. What do you think it is?
I think I know exactly what's wrong with him. I need to go check something in the records.
Sorry, Johnson, I have to go. I'll catch up with you later.
Sorry for the intrusion, but we need to act fast. Mastocytosis was a misdiagnosis.
Hawks, you can't just barge in here without proper gear. It's a sterile environment.
This is unacceptable, Hawks. You're bringing the patient at risk?
I understand your concerns, but trust me on this. It's persistent truncus arteriosus.
What's the prognosis for persistent truncus arteriosus?
The prognosis is serious, but with immediate surgery we can improve the outcome significantly.
We can't delay. Let's prep the patient for surgery immediately.
Agreed. Let's save this life. Tracy, I finally got to the bottom of the patient's issue. It was a rare condition we hardly see, but I managed to diagnose it correctly.
That's great news, Hawks. I'm glad we could solve the mystery.
Yeah, well, this whole misdiagnosis fiasco could have been avoided if I wasn't surrounded by incompetent doctors.
Hold on, what do you mean by that? You were the one who initially made the wrong diagnosis, Hawks.
Well, you see, my diagnostics team should have caught my mistake sooner.
Hawks, you're shifting blame when you're the one who declared the wrong diagnosis. Own up to your error instead of throwing others under the bus.
I don't have time for this, Tracy. I'm done here.
Hawks, we need to address this issue before it affects patient care. You can't just walk away when things get tough.